Hello, and welcome to Access Rhode Island. My name is Rachel Flum, and I'm a policy analyst with the Poverty Institute and your host for this week's program. I'm pleased to be joined today by State Representative Maria Cimini, who represents District 7 in Providence and serves on the House Health, Education, and Welfare Committee. Thank you for being here, Representative Cimini. We also have with us Heidi Collins, who's the Director for the Center for Financial Success at Connecting for Children and Families in Woonsocket. Heidi is a former Poverty Institute staffer, so I'm thrilled to have her here today to discuss her current work and some issues that I know she has been involved with for many years. Thanks for being here, Heidi. In extremely difficult budget years, the poor often get blamed and scapegoated for many of our problems, and this year is no exception. We often hear about social service programs being a significant factor that is causing our state's budget problems, and I want to take this opportunity to focus on one particular program, the Rhode Island Works program, which is Rhode Island's welfare program. There's a lot of misinformation out there about the program and the people it serves. We hear that our time limits and benefits are more generous than other states, that families on welfare have lots of children, and that the state spends too much money on this population of people. We know that these things are not true and hope to clear up some of that confusion today. Before Heidi and Representative Cimini help me dispel these myths, I want to tell you about the Rhode Island Works program briefly. The Rhode Island Works program serves 6,600 families in Rhode Island. These families have young children, and the families get a small cash benefit a month. Get a small cash benefit payment each month. For example, a family of 3 receives $554 a month, and this amount has not been raised in over 20 years. Rep. Cimini, can you tell us a little bit about who is on this program in terms of what the population looks like?
Certainly. Thank you for having me here today. The program consists, as you said, of 6,600 families, the majority of whom are children. The majority of the recipients of the program are children. The 6,600 families represent about 16,000 people. The majority of them are children. In fact, about 40% of the cases of Rhode Island Works consist of child-only households, meaning that only children in the household are getting a cash benefit. No adult in the household is getting a cash assistance at that time. In addition, most of the families are small families. The vast majority of families have fewer than two or fewer children in them. So we're not talking about families that have multitudes of children. It's small families just struggling to get by.
And can you also tell us a little bit about the cost for the program? Is it an expensive program for the state to run?
Well, that's actually a kind of confusing question in that it's somewhat is federally funded and some is state funded. But the big answer that I want to give, the thing I want to make sure people understand, is that there are actually no state funds that go towards cash assistance. So that $554 a month that you mentioned is not state money. It's federal money that's being spent locally here in Rhode Island.
And I think that would be very surprising to a lot of people.
I think so too.
Can you also tell us about if the program has grown in recent years? Are there a lot more families? Are the 6,600 more than were on a few years ago, or is the caseload getting smaller?
The caseload is actually getting much smaller. Rhode Island has seen a tremendous decline over the past decade or so, or longer than that. The TANF program, which is the federal program for the cash assistance program, went through a full change in 1997 with welfare reform. And then in Rhode Island, we again changed the program dramatically in 2008, where we went from the Family Independence Program to the Rhode Island Works program. At both those times, in 1997 and in 2008, new time limits were introduced to the program, causing many families to lose their assistance. In fact, since the recession started, only 6 states in our country have seen a decline in their caseload, and Rhode Island saw the greatest decline of almost 29%, 28% of there was a 28% decline in caseload in the state of Rhode Island since the recession began, which is really counterintuitive when you think about how cash assistance is supposed to be available to families when they're in their hardest times. And when we were facing our hardest times, our cash assistance program was not available.
So can you tell us a little bit about the time limits again? You said that we changed a couple years ago. Can you tell us a little bit about what the time limits were and what they are now for families?
Certainly. So with welfare reform in 1997, or 1996 rather, the federal government implemented a 60-month time limit for cash assistance. So families couldn't stay on for more than 60 months except for extreme hardship situations, which really did away with what people thought of as generational welfare recipients. Rhode Island in 2008, though, made those time limits stricter. And what they said was you can stay on for 24 months in a 60-month period with a 48-month lifetime cap. So you could actually receive cash assistance for 48 months, but only under those periodic time limits of 24 months at a time.
That sounds pretty confusing.
It's very confusing. It's confusing for families, and it's confusing for the state to implement.
And then, so what do other states in the country do? Do a lot of them have the short 24-month time limits, or are they mostly longer?
It's actually very rare to see the 24-month time limit. I believe it's 35 states have a 60-month time limit, and then the periodic time limit of 24 months is even rarer than that.
So, and it sounds like what you said about the caseload in the recession means that the program may not be working as it was intended. Another question that I had was about what the myth that the benefits are more generous than in other New England states. Have you found that to be true?
That's definitely not true, that our benefits are more generous. As you said, it's a family of 3 gets $554 a month, which hasn't been increased in 20 years. And I believe that Massachusetts benefits are higher than that.
And yeah, I think actually when I was doing the research, Rhode Island's are the second lowest in New England, so we really aren't, it's not true that we're the highest. Now Heidi, I know that you work with a lot of these families in your program. Can you tell us a little bit about what the program was designed to do originally? I know you've worked on this for a long time.
Sure. So the Rhode Island Works program, as you stated, is our state's cash assistance program, and it's a very important government assistance program to help our most vulnerable children in the state. As you stated, Rachel, it provides a very small cash payment, and for those who are not aware, that the cash payment for our families on Rhode Island Works is 64% below the federal poverty level. And so we're talking about families that are the hardest served families, children who are in trouble in the state, who really have parents who don't have assets, don't have earnings, don't have any education or skills to obtain a job, and very often don't have a support system in place to help them meet their family needs. And so the Rhode Island Works program really is a temporary program to provide those resources to our most vulnerable children. And for Connecting for Children and Families, we are quite concerned that this is a program that should be helping families move off of the system and build their family economic success, and providing the resources such as a small payment, providing work readiness services, which is what the program is designed to do, and preparing people that have low skills to get into those work readiness programs and be able to get them into jobs.
So it sort of has two goals then, right? It's to provide a safety net for children, and then also to help their parents get into the workforce?
Exactly.
Is that the sort of goals of the program? So can you give us an example of how the program, through your work, you see that the Rhode Island Works program is not working as it's intended?
Sure. So as it's been stated, since 2008, there have been a lot of changes that were put into place to significantly impact the families that are being served by Rhode Island Works. Currently, under the new plan, over the last 2.5 years, families have been subject to what's called a work-first approach, which means that if you're on cash assistance and you're engaged in an employment plan activity, your first activity must be to look for 4 weeks of job search at the Network RI one-stop centers, which are located in many of the communities across the state. And what's happened is that when these parents are being engaged in this 4-week job search, they're being told that for 4 weeks they have to look for a job, but yet these are the same parents who have limited education backgrounds and very little skills in order to compete in this economy. And so what we feel at CCF and many other organizations that have been serving these families is that families are wasting 4 weeks at the Network RI one-stop centers doing job search, when in fact they really could benefit from doing some more intensive short-term training programs to gain the education and the skills that they need in order to be able to compete for the jobs. At the time that the Rhode Island Works program was changed, the unemployment rate was skyrocketing, and it was at the worst time to implement a workforce approach for families who have limited or no access to education and skills. And so, as the economy is still in a tank, so to speak, we need to make improvements in the program to be able to allow people to access